Hello everyone, in this video let's see what is meant by tuberculosis. Introduction. First of all, tuberculosis is one of the most prevalent infections of human beings and contributes considerably to illness and death around the world. It is spread by inhaling tiny droplets of saliva from the cough or sneezes of the infected person. It can slowly spread chronic granulomatous bacterial infection characterized by gradual weight loss. TB is the world's second most common cause of death from infectious disease after HIV/AIDS. Okay, TB means tuberculosis is one of the most common infectious disease. Disease means it is caused by a bacteria, virus, or fungi. It is mostly caused by a bacteria. It is caused by a bacteria. It contributes to the illness and death around the world. It is the leading cause of death and illness. It can spread from one person to another. It's a communicable disease. How it is spread means through cough or sneeze droplets from the infected person. It is slowly, yes, it can spread. And chronic means long-term disease. Granulomatous, it's a bacterial infection characterized by an cough and weight loss. TB is one of the second most common cause of death and infection. The first leading causes of infectious diseases of which cause death is HIV/AIDS. Definition: tuberculosis is the infectious disease primarily affect the lung parenchyma, is most often caused by Mycobacterium tuberculosis. It can also spread to any part of the body, including meningitis, kidney, bones, and lymph nodes. Yes. Tuberculosis is an infectious disease. It mainly affects the lung parenchyma. It is mainly caused by a Mycobacterium tuberculosis bacteria. It can also spread from lungs to brain, kidney, bones, and cause the infections in that organs also. Types of TB. First one is pulmonary TB. Next all are then avian tuberculosis, which is caused by Mycobacterium avium of birds. Next one is bovine tuberculosis, which is caused by Mycobacterium bovis of cattle. And then miliary tuberculosis or disseminated tuberculosis. Miliary tuberculosis means it can invade through the bloodstream and spread to other organs. First, pulmonary TB. Pulmonary TB means mainly TB affect the lungs, which can cause infections, which can damage the alveoli and cause infections. This infection is spread through the lungs, and destruction of the lungs happens due to the bacteria. It's called pulmonary tuberculosis. Avian bovine extrapulmonary tuberculosis is also present. Extrapulmonary means it is spreading to other organs like kidney, brain, etc., and cause meningitis and kidney related problems. Miliary tuberculosis means also spreading through the bloodstream and spread to other organs. Incidence. With the increased incidence of AIDS, TB has become one of the great problem in US and the world. India, yes, India is the highest TB burden country in the world, home to 20% of the cases occurring globally. Each year, 1.8 million develop TB. In India, 0.37 million people dies due to the TB every year. So the epidemiology. Next one is risk factors. What are the risk factors means? Close contact with the some of who have an active TB infection. If we have close contact means it can cause it can spread to us also. Immunocompromised, yes. Because any infectious disease which caused by bacteria, our immune system will activate and fight against it. If immunocompromised patients means, yes, definitely our WBC will not fight against the disease. So immunocompromised status, elderly, cancer patients, they are immunocompromised, right? Drug abuse, alcoholism, people lacking adequate health care, pre-existing medical conditions like diabetes, chronic renal immigrants from the yes, countries from if we immigrates from the countries with higher incidence of TB, means we will be get affected. Next, institutionalization means long term care facilities. uh, Next, living in substantial conditions, occupations, these are the major risk factors for TB. Pathophysiology: when the initial infection, the TB infection, the bacteria enter into the when we are close contact with the infected person, it is spread from his cough or sneeze. The droplets will enter into our nose. Next, through it will enter into the lungs. uh, Entry of the microorganism then it will reach the lungs alveoli. In the alveoli, our macrophages will neutrophils are begin to fight uh, against the disease. But the tuberculosis, the mycobacterium has specialized cell wall which is not destroyed by the macrophages. This macrophages, when it phagocytes the bacteria, the bacteria enter into the macrophages. The macrophages will release the chemicals, but also bacteria was not killed. It will survive and it will start to replicate inside the macrophages. Then if we phagocytes, it will, and then when the macrophages um, then our immune system will get activated. Then all the immune cells, all the macrophages will come to and attack and keep the TB in hold, bacteria in hold. This is called latent TB. The patient is affected by TB, but it will not spread. It will not cause any infection. But when our immune system gets weakened, this macrophages will burst and all the infection will released. The bacteria will get released into the blood. Then it will spread to other organs, and the patient will become a TB patient. The pathophysiology. Next, clinical manifestations. First one is congenital symptoms: anorexia, loss of appetite, low grade fever, night sweats, fatigue, tiredness, weight loss. These are congenital symptoms. Next is pulmonary symptoms: dyspnea. Next, non-resolving bronchopneumonia, chest tightness, non-productive cough with the major symptoms in TB. And then mucopurulent sputum with hemoptysis, chest pain. Next, extrapulmonary symptoms include pain, inflammation. These are the clinical symptoms. Next one is assessment and diagnosis. First, we have to collect all the history. Next, physical examination, clubbing of the finger and toes in people who have advanced TB. The patient's hand will get clubbed. We can see the difference, and using that we can confirm the TB. Swollen or tender lymph nodes in the neck and other areas. Fluid around the lung, pleural effusion, unable to breathe. Breath sounds will be cracked. Miliary TB means physical examination shows swollen liver, swollen lymph nodes, swollen spleen. Test also may include biopsy, rare test, but biopsy can also be taken. Bronchoscopy, chest CT scan, chest X-ray, interferon gamma, release blood test. Then QFT, it is interferon gamma release blood test. This is the gold standard test. Sputum examination, culture test, fluorescent test is tuberculin skin test. Those are all the tests we can check. And then quantiferon gold test, which will measure the interferon gamma in the testis blood. After incubating the blood with the specific antigens from Mycobacterium tuberculosis protein. Next, tuberculin skin test, a zero point 0.1 ml of PPD is injected for after 48 to 72 hours. Check for induration in the site. If induration equal or more than 10 means the patient has TB positive. Then what are the complications? Bones, spinal pain, and joint destruction may also result from TB that infect your bones. TB spine, spot spine. Next one is brain. In brain, meningitis will be caused. Liver or kidneys, there will be also affected. Heart, in heart, cardiac, pericarditis, pleural effusion. TB can cause pneumonia. Serious reactions to drug therapy like hepatotoxicity, hypersensitivity reactions. These are the complications. Next one is medical management. Pulmonary TB is treated primarily by anti-tuberculosis agents. We have to treat the patient for 6 to 12 months. Pharmacological management. First line anti-tuberculosis medications like streptomycin 15 mg per kg per day. Isoniazid or nitrazide 5 mg per kg. We can give 300 mg, which is the maximum dose. Rifampicin 10 mg per kg per day. Pyrazinamide 50 to 30 mg per kg per day. Next, ethambutol 15 to 25 mg per kg daily for 8 weeks and continue up to 4 to 7 months. Second line medications, which includes capreomycin 12 to 15 mg per kg, ethionamide 15 mg per kg, para-aminosalicylate sodium 200 to 300 mg per kg, cycloserine 15 mg per kg, vitamin B pyridoxine usually administered with isoniazid rifampicin. Third line drugs, which includes other drugs, rifampicin, macrolides, antibiotics, clarithromycin, linezolid, thiazolidazole, thioridazole, arginine. Dot means directly absorbed treatment. It is a short course treatment. It is the name given by the World Health Organization recommended tuberculosis control strategy that combines five components. Government commitment, including both political will at all levels and establishing a centralized and prioritized system of TB monitoring, recording, and training. Case detection by sputum spear microscopy. Standardized treatment regimen directly observed by a healthcare worker or community health worker for at least the first 2 months. A regular drug supply, a standardized recording and reporting system that allows assessment of treatment results. Dot is especially critical for patients with drug-resistant TB, HIV-infected patients, and those on intermittent treatment regimens 2 or 3 times weekly. Admits directly absorb the treatment. A short course. We have to monitor the patient who was under the treatment, and we have to ask the patient to take the medications regularly without fail. We have to detect the drug adherence of the patient, and we have to follow the patient and force the patient to take the medications without missing any of the doses. That only the treatment will be continued, and we can control the spread of the infection, and we can treat the TB. Next one is multiple drug therapy. It is for severe and TB cases. If the patient we can give isoniazid, famotidine, or pyrazinamide for 2 months, and treatment also then continued with at least 4 months with a few medications. Nausea management, we have to assess and obtain the history of exposure to TB and assess for symptoms of active disease and escalate lungs for crackles during drug therapy, assess for liver function. Nursing diagnosis, ineffective breathing pattern leading to pulmonary infection and potential for long-term scarring with a decreased lung supply. Inefficient breathing means intervention. What we have to do means administer and teach the self-administration of the medication. Encourage them to rest at avoid of exertion. Monitor birth sounds using the respiratory rate, speed of production, dyspnea. Provide supplementary oxygen. Encourage increased fluid intake. Strict about best position to facilitate the dryness. What risk for spreading TB means we should aware the TB spreading by respiratory droplets. So use the high efficiency partition mask. Then educate the patient to control the spread by covering the nose and mouth during coughing and sneezing. We can isolate the patient. Instruct about the risk of drug resistance. If drug regimen is not strictly and continuously followed. Carefully monitor the HSNs and observe for the temperature changes. Next, imbalanced nutrition less than body requirement related to appetite, fatigue, and productive cough means we have to explain the importance of taking nutritional diet, fruits, vegetables. Provide small frequent meals, monitor the weight of the patient, administer vitamin supplements as ordered. Next, non-compliance related to the lack of motivation and lack of treatment. First, we have to educate the patient about the etiology, transmission, and effects of TB. If we can ask an adverse effect was happened due to drug therapy, participants participate in the observation of the medicine taking weekly pill counts or programs designed to increase the compliance with the treatment for TB. Explain that TB is a communicable disease, it can spread, and take medication is more effective way. The medication is the most effective way of preventing transmission. Instruct about medication schedules and side effects. Prevention. Isolation. We can isolate the patient, ventilate the room, cover the mouth, wear mask, finish entire course of the medication, and we can vaccinate the patient. That's all we have seen the tuberculosis. Let's revise what we have seen in tuberculosis. First, we have seen what is meant by TB. Tuberculosis means what, how it is spread, bacteria, it's a communicable or non-communicable types we have seen. Next, epidemiology we have seen. Next, risk factors, pathophysiology we have learned. Next, clinical, and that such symptoms, constitutional symptoms. Next, pulmonary, extrapulmonary symptoms we have learned. Next, how we can diagnose the patients with TB. What are the gold standards test, and we have learned what are the complications of TB. Medical management, what are the pharmacological therapy for the pulmonary TB, first line, second line drugs, third line drugs. Dots, we got direct observed treatment we have learned. And multiple drug therapy also we have learned here. Nursing assessment, what are the nurses we have to do, what are the role of the nurses, and how we can prevent the TB infection spread from spreading to one person to another. We have learned that. That's about TB. In short, we can say TB is a pulmonary disease caused by an pulmonary infectious disease caused by an mycobacterium tuberculosis. It's a communicable disease. Then it mainly affects the lungs and can also spread to other organs. It can spread from a person to person through coughs, sneeze, droplets. So we can prevent. How we can prevent the spread means isolating the patients, wearing mask, or not communicate with the infected persons. That's all. Then what are the diagnosis? Mainly clinical manifestation. The big cough. Cough and is fever, like that symptoms. Then also pathophysiology means it has a main cell wall which can prevent the bacteria from destruction from the macrophages, so that it will first become a latent, and during a immunocompromised situation it will spread to other organs and it can cause infection. That's all. Thank you.